Readiness on the vaccine front have now drawn international scrutiny. On Monday, UK scientists raised an alarm with a new variant in SA saying it's risky. Now, so many questions come to the fore. Why is this variant such a concern internationally? Will it work if it's on the vaccine front? Well, for more discussion on this, let's bring in Professor Wolfgang Preiser, head of the Division of Medical Virology at Stellenbosch University. Professor, thanks very much indeed for talking to us. First of all, is there anything empirical that would suggest one variant of the COVID-19 virus is more deadlier or fatal than the other? The UK Health Secretary certainly showing concern yesterday for the South African variant. Is there evidence to support this sort of anxiety?
Well, the good news that we do have is that we have no evidence so far that any of these variants of the virus that have emerged now are more dangerous in a clinical sense, so that they cause more severe disease in patients who become infected. So that's the good news. The not so good news is that there are some concerns, and they have yet to be fully substantiated, that these variants, and that is certainly applies to the UK one, may be more easily transmissible than the previous viruses that we have encountered so far during the pandemic. The concerns as regards the South African strain and its transmissibility have yet to be fully substantiated, but of course, seeing our enormous resurgence over the past few weeks, which coincided with the rise of this new virus variant, it makes one worry. And I can say that at this very moment, several research groups around the country are trying to home in onto that question and trying to find an answer, whether it is true that it is more easily transmitted, and if so, how much worse it is.
And that brings us to the next point of concern, which again came out from some UK officials saying that the vaccine might not necessarily work on the SA variant or other variants for that matter. Is there concern on that front?
There is, in the sense that the vaccines that we are hearing about and that have made it very miraculously quickly through the whole pipeline within less than a year, those vaccines target the spike protein, which is the surface component of the virus. So they basically mimic this and cause the body to form an immune response to that. Now, both variants, the UK one and ours, have changes in that spike protein. So, it is right that one needs to worry whether these changes might influence the body's ability after vaccination to neutralize these viral variants. Now, for the UK one, people seem to agree that risk is very small. For ours, now some people in the UK are worried that it may be bigger. The verdict is clearly out, and the only way to find out is by doing the type of research that is currently happening here already, that is looking at people who have had COVID before and who have formed an immune response, and looking at people who have, and in our case, in the context of clinical trials, who have received these different vaccines, and looking whether their bodies, i.e. their blood, is able to recognize the new variant. And these things are happening at a very rapid pace. So I'm confident that over a few weeks we'll hopefully know whether that is indeed a worry. Personally, I would imagine that at this stage, there's no reason to panic. I don't think we need to throw up our arms in despair and say the vaccine is not going to help us. I think, if anything, we're talking of a slight decline in vaccine efficacy. We are not talking of a vaccine totally not working, but it might be that it is somewhat less efficacious against the South African variant than against the others. And it may not also be the case for all of the vaccines. So, I think there are many variables, and we really need to do these tests.
I see there were also talk about the fact that vaccines could indeed be tweaked according to what happens on the variant front. But one wonders whether or not that's a time-consuming and costly exercise.
It's relatively easier than it would have been with the vaccines that are now in clinical use widely, for many decades around the world, because these are old-fashioned vaccines. Now, what we are having here are really innovative ways of making vaccines, where you insert a piece of viral genome into either a carrier virus, which is harmless, or into just in the form of messenger RNA into some innovative capsule, which then gets injected. And the upside of this is that it works very fast. And that's what we've basically seen, that it took less than a year for these vaccines to undergo all the clinical trials and now to reach basically the healthcare service. So now the question is, can we get enough and quickly enough, of course? But this happens very quickly, and to change, to tweak this genetic information shouldn't be a major process. That said, it's not a question of days or weeks. It's clearly a question of months. And of course, these new tweaked vaccines would also have to undergo certain forms of clinical trials to make sure they work and they are fine.
All right, Professor, we're going to have to leave it there. Thanks very much indeed for your time. Yeah. Professor Wolfgang Preiser, head of the Division of Medical Virology at the Stellenbosch University.